The way I like to look at a concussion is like the old-time telephone switchboard operator, the kind that's got to put the pegs in to connect the different phone calls, and then someone came to that switchboard with a baseball bat and hit it and knocked those pegs out. And however long it takes that telephone switchboard operator to put those pegs back in, put them in the right holes, and to have them stay is how long it takes for that individual's brain to heal from a concussion. So those pegs tend to correspond to 4 groups of symptoms that we see with concussions. First are physical signs and symptoms: headaches, nausea, vomiting, lightheadedness, dizziness, light hurting your eyes, sound hurting your head, vision changes, ringing in the ears, balance problems. Next are cognitive changes, so thinking changes, trouble with word finding, trouble with memory, trouble with math, slowed reaction time, slowed processing speed, difficulty maintaining focus, attention, concentration, feeling mentally foggy. After that, there's sleep disruptive symptoms, so trouble falling asleep, trouble staying asleep, or being overly tired, taking daytime naps when you normally wouldn't, sleeping 12 or 14 hours a day. And then finally, emotional symptoms, because your brain's in charge of your emotions. So these are folks who are normally pretty even keel emotionally, all of a sudden happy, sad, angry, glad, crying for no reason, excessively irritable, short fuse, snapping at people that you normally wouldn't. In terms of treatment of a concussion, first and foremost, we want folks to meet 4 criteria before we start them back to a graduated return to play, not too dissimilar than you would with an ankle injury or a knee injury. The 4 criteria that we like to see in the office for them to meet before we start them that would signify brain healing at rest is going to be no symptoms, back to how they were before they had their head injury in terms of any concussion-related symptoms having completely resolved for a period of time at a minimum of 24 hours, a normal neurologic exam, normal balance testing, which we do in the office, and then normal neurocognitive testing, either with paper and pencil testing in the office or done by a computerized testing, neurocognitive testing. Once you've met those criteria, you can get started on a graduated return to play, and there's steps to that. With each step incrementally stressing the brain a little bit further to make sure that the symptoms that that individual, that athlete might have been experiencing before don't come back. The first step after you've met those 4 criteria is usually just some light aerobic activity, so walk a minute, jog a minute, elliptical machine, stationary bike, treadmill for 30 minutes. The next step is going to full aerobic conditioning, wind sprints, running stadium steps, things like that, and then also doing some non-contact position drills, throwing a baseball, catching a football, running patterns, shooting hoops, kicking a soccer ball, things like that. Next step after that's going to be a full non-contact practice, and that you're also going to add in some resistance strength training, because when you do the strength training, it's actually harder on your brain than the aerobic conditioning. It increases intracranial pressure and shakes that switchboard that we talked about a little bit harder, potentially bringing back more symptoms. After that, after doing a full non-contact practice, then you're going to go to controlled contact practices, whether they're header drills or controlled tackling drills. And then if you get through all that without the return of any of the symptoms that you were experiencing before with a concussion, then you can be moved on and be cleared for a full return to play.